This is a video to explain how to transmit your vital signs and EKGs to your run reports. So the first thing we're going to do is make sure the Bluetooth is turned on the Tough Book, which it already is. The second thing we're going to do is make sure the Bluetooth is turned on the Lifepack 12. You scroll up to your yellow box is highlighted right there. This shows that we're actually already connected, but if that blue dot was not on there, you would scroll up to it, connect, and you would search for it. So the name of that Tough Book is BFFR Medic. So it's already connected. See, if you needed to find devices, it shows devices. We're just gonna go back to hit home. So if we already had a patient, we dropped them off at the hospital, and we have vital signs, and all is connected. Well, first thing you gotta do you have to do this on the Tough Book, is you gotta go to vitals, hit monitor import, and the screen needs to pop up. Leave it at that screen, go over to your Lifepack, hit transmit. We need to make sure it says report all, and then the BFFR is the site we're sending it to. You gotta scroll to it and hit send. So it transmitted, and this will print off, and if this says transmission complete, then it's successfully transmitted. If there's any kind of failure, it'll show the error. So then once you've got that, just go up here to local. We don't do cloud here, we do local. Okay, once that's already transmitted, we go here to local, we find our run report. Here's our run report, we click it. And if there are no vital signs on this because we didn't do a patient, but if there were, we're gonna click it, hit import. It would tell you the vital signs, but it does say there's a flowchart item imported, so we'll click OK. So this will give you an example of the flowchart. So what you can do on your run reports is you can hit event, and then you can scroll and just say we gave an IV. So we're going to scroll over to it, click, and then when we transport our vitals, it will show up on there. This is also good for EKGs and 12 leads that we need to attach to our run reports, and no more taking pictures. The other thing we got to remember doing with our patients is to hit print every now and then if you have a 4 lead. That way it takes a 3 or 4 second clip, and that way we can attach it to our patient, especially if we have capnography on the patient, and we can see the capnography waves too. That will do it. So if the monitor gets shut off and you weren't able to transmit your vitals, you can still transmit your vitals. So still go over here to vitals, hit your monitor import, make sure that screen's up. You go to options on the monitor, you go to archives. Yes, we want to go to archives. It pulls this up. We want to hit send data. We got to go down here and make sure we connect. So we can connect. We need to find devices. Find our device. We're going to hit stop. So go down here. We're going to connect to that. Go back to previous page. So we need to find our patient now. Just say it was the patient from 1205. We're gonna go down to it, scroll, hit it, and then when we're ready, we just hit send. And that will send you a patient from previously.